Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth Heart Circulation Warning Signs. And trust me, it's juicier than your cousin's peach cobbler. Your legs are cramping, your hands feel cold, and you're getting dizzy when you stand up. Now I know what you're thinking. Doc, that just sounds like Tuesday after 40. But hold up there, partner. These aren't just minor annoyances or signs you're getting older. These are your heart desperately trying to send you a telegraph message, and the message is this. Houston, we have a circulation problem. I'm going to show you exactly what to watch for and what to do about it, because your heart is basically like that friend who drops hints instead of telling you straight up what's wrong. Except in this case, ignoring those hints could land you in my operating room, and trust me, nobody wants that kind of excitement. Let's start with something I see every single day in my practice: cold hands and feet. Now, I'm not talking about stepping outside in January wearing flip-flops cold. I'm talking about the kind of cold where your hands feel like ice cubes even when you're sitting in a 75-degree room. Here's what's really happening, and this is where it gets interesting. When your heart can't pump blood efficiently, your body goes into survival mode. It's like your cardiovascular system becomes that parent who only has enough allowance money for 2 kids but has 3 children. Somebody's getting shortchanged. Your body prioritizes your vital organs, your brain, your heart, your kidneys, and your poor fingers and toes are basically sitting at the kids' table getting the leftovers. Yep, entirely true, I can't make this stuff up. Your extremities get shortchanged on that warm, oxygen-rich blood they need to function properly. So if you're constantly wearing gloves indoors or your spouse complains that touching you is like grabbing an ice sculpture, maybe I should see you in the clinic. We need to talk. Now, let's move on to something that'll really get your attention: unexplained fatigue and dizziness. You know that feeling when you stand up too fast and suddenly the world starts spinning like you just got off the tilt-a-whirl at the county fair? Or when you feel like you need a nap after walking from your car to the grocery store? Here's the deal, your brain and muscles are basically throwing a tantrum because they're not getting adequate blood flow. It's like trying to run a high-performance engine on fumes. You get that heavy legs feeling, that mental fog where you can't remember where you put your keys, and that overwhelming sense that everything requires way more effort than it should. The sneaky part is these symptoms often get worse throughout the day as your heart works harder and harder, like a little engine that could, except it really can't anymore. But here's where things get really interesting. Let's talk about leg pain. I had a patient, let's call her Sarah, who came to me convinced she was just getting old. She'd developed this cramping and aching in her legs during normal activities. Walking to the mailbox, climbing stairs, basic stuff that used to be no problem. The telltale sign? The pain would improve when she rested but came roaring back the moment she started moving again. Classic circulation issue. Plus, she had swelling in her ankles and lower legs that she kept blaming on standing too much at work. Sarah had been ignoring cold feet for months, blaming her fatigue on stress at work, and writing off those leg cramps as punishment for trying to be more active. Sound familiar? When she finally came in, and I mean finally because she'd put it off for 6 months, we discovered significant circulation problems that could have led to serious heart complications. The good news, early recognition and treatment completely resolved her symptoms within weeks. She went from feeling like she was dragging around concrete blocks for legs to walking 3 miles a day pain-free. Here's what I want you to do right now, and I mean right now while you're listening to this. Check your circulation with this simple test. Press down on one of your fingernails until it turns white, then release it. It should return to that normal pink color within 2 seconds. If it takes longer than that, or if it stays white and pale, that's your circulation system waving a red flag bigger than the one they use at NASCAR races. Don't ignore your body's warning system. Your heart is constantly communicating with you, and these circulation warning signs are its way of tapping you on the shoulder before it has to grab you by the collar. Trust me, you want to catch these signals early, because the alternative is a lot less fun and involves a lot more medical equipment than anyone wants to deal with. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.